right from the start, one of the biggest pieces is just really understanding your body and knowing what it's telling you. Because I think so many of us are walking around dissociated and disconnected and just like so used to pushing symptoms down that we don't realize anything's wrong until it's like too late and everything's wrong, everything's flaring.
Welcome back. Today, we are talking about mystery diagnoses that are far more common than most of us realize. These are conditions that often go undetected, are misunderstood, or dismissed in women's health. We're talking about EDS, hypermobility, and POTS. If you've ever felt like your symptoms didn't add up, or if you've been told everything looks normal when you knew something was off, this conversation is for you. I am joined by expert Nicole Woodruff, an occupational therapist based out of Tampa, Florida. Nicole isn't your typical therapist. Yes, she has spent over 13 years studying pelvic health, fascia, chronic illness, but she also comes at this from the perspective of having lived and managed EDS and POTS in her own life. She knows firsthand what it feels like to live with these conditions, and that perspective has been really helpful in shaping the way that she approaches her patients. Nicole is the founder of Intuitive Therapies and Pelvic Health, where she helps women with complex conditions feel more confident in their bodies again. She blends advanced therapy techniques with empathy and meeting women where they are and helping them build real sustainable strategies for healing, movement, and daily life. In this episode, we're diving into EDS and POTS. So if you've heard these terms but you don't know exactly what they are, now you're going to learn. We're going to talk about what they are, how they impact you, and what it really looks like to navigate life and healthcare with these conditions. She's telling us how to find help. She's telling us how to tailor a treatment plan for you. And she talks about how she helps other women do this, helps them juggle their chronic illness, pelvic health challenges, while living their ordinary everyday lives. We're going to touch on big topics like sensory overload, hypermobility, and the question we hear most often, which is there hope? I am really excited for this very valuable conversation. It is practical, but also deeply validating. So I hope you enjoy. If you do enjoy, leave me a message. Leave us a review, share with a friend. We really need to get the word out on these conditions, but also we want to keep sharing good information for women in general, and having you share these episodes and leave reviews is exactly how we do that. So let's get started.
What are some things I can put inside my toolbox, my personal toolbox, to help me manage that symptom? It's helping people kind of break down the pieces of their day-to-day life and find strategies that don't seem so hard, that don't seem so complicated.
Well, Nicole, thank you so much for being on today. This is a really important topic we're going to be covering, and actually a mix of topics, but something that I don't think enough women still know about. So we're talking about hypermobility, Ehlers-Danlos Syndrome, and POTS, and kind of all of the things that go into that. And I think there's going to be lots of learning here, because I do think a lot of people still don't really know what those things are. So thank you for being here.
Yes, thank you so much for having me. And absolutely, it's the biggest part of my journey. And honestly, like one of my biggest parts of my mission is to educate people about these conditions and how they can often be misdiagnosed or like delayed diagnosis for so many years. And in the meantime, so many women and men, are just left honestly misunderstanding their bodies for a very long time. So
Yeah, you've dedicated your career really to this subset of people and women who have this connective tissue difference and how that affects their pelvic health. So I'm really excited to dive in. So let's get started. First of all, I'd love it if you could share a little bit of your own experience, because you're coming at this topic from the perspective of a practitioner who has studied this and worked with lots of patients, but also from your own lived experience. So do you mind sharing a little bit about that journey of how you came to be so passionate about these topics?
yes, absolutely. So it's kind of an interesting journey as I look back, but essentially I ended up with like chronic pain in my 20s. So I didn't quite understand what was going on or why I was experiencing symptoms that I was, but I just noticed that, say I'd be like out shopping with my friends at the mall, like this back pain and like this huge urge to sit down and just feeling fatigued after a short amount of time. And I'd look around at my friends, and I was 25 at the time. So this would be
Yeah.
something that's so challenging. And my friends are like, they could go for hours. And I'm like, there's something different here about me. And my sister had already been diagnosed with fibromyalgia, and my mom had some chronic pain. So I thought maybe that was what was going on. And so after a little while, I got, just evaluated by my general practitioner and eventually was given the fibromyalgia diagnosis. But the interesting thing is, I just didn't really ever feel like attached to that diagnosis. I hid it from a lot of people. I didn't talk about it much. I, tried a few medications. I did physical therapy. I did massage, chiropractic, yoga, like all the things that they say to do when you have chronic pain. But I just never really felt good with all of that. I managed, right? And I was in my 20s, so it's a little bit easier to kind of bounce through chronic pain at that age. But it really wasn't until I became a mom in my early 30s that I started to see more going on here. And
Mm.
honestly, it was after the birth of my second that I listened to a podcast about EDS and POTS. And I just knew immediately. It was like, this is it. Like this explains, I
Yeah.
feel like explains my whole life. And so I looked up, I live in the Tampa Bay area. So I looked up a specialist and was able to get in a few months later. And I was diagnosed with both conditions in that appointment. And I do consider myself lucky. I know a lot of people really struggle with the process of getting that diagnosis and finding a specialist. And we can get into that more then. But I feel very fortunate that I was able to find a doctor and felt supported in knowing, okay, there is more to the story here, and be able to like make sense of the symptoms I had honestly experienced on and off since childhood that I did not even know were not normal. There were so many things I thought were just normal to live with.
And I want to get into that a little more of like, what do people feel like who have these conditions? And maybe that is where we'll go next because I want to see both sides of it. What does it feel like to have these conditions? But then what do we do about it? And what did you do about it as an individual? But also what are you doing about it as a practitioner? So maybe we'll just take a little jog here. If you'll continue your story, what happened then that got you feeling where you were more in control of things and feeling better?
Yeah. So I guess just to go back just a little bit, like to what I experienced like throughout my life was systemic GI issues was a big thing.
Mm.
I was always bloated, always had stomach pain and just never felt good after eating. And again, when you feel like that your whole life, you just think that it's normal to feel kind of icky after you eat a meal. So I lived with that my entire life. And then obviously I mentioned the chronic pain piece, but then the POTS part was the really interesting thing to me. And honestly, what pulled me in to make me actually want to pursue a diagnosis. As a healthcare practitioner, I've been an OT for 13 years, and I've met patients in my time earlier in my career who had POTS, and I thought it was more passing out and having significant cardiac issues, and I thought that can't possibly be me
Yeah.
until I learned that there's a lot more that's involved with that condition. And when I heard more of the spectrum of symptoms, I fit into that criteria for sure. So that's what made me want to get diagnosed. And
Yeah.
that initial doctor who I evaluated me did prescribe some medications for POTS at that first visit. And I was super nervous. I don't think I took them for over a month. I like am always scared to try new things and take new meds because you don't know how your body's going to respond.
Yeah.
But I am somebody who lives with chronically low blood pressure. So one of the medications is midodrine, which helps to bring up your blood pressure somewhat. And when I finally tried it, I was like, this is life changing. Oh my gosh. Like I can go to a
Mm.
concert and I feel okay standing for a
Yeah.
longer period of time. And I learned more about the importance of not just hydrating with water, but hydrating with electrolytes. And I made that a big priority for myself. And I also learned to listen to like the inner cues of my body. I was so used to my entire life just pushing through and honestly kind of gaslighting myself into thinking that I'm just lazy or
Yeah.
why do you feel this way? Everybody else is fine. Just get up off the couch, just go do what you need to do. And now I know when I have certain symptoms or I feel that heaviness and that fatigue hit me, like, it's okay to rest. It's okay to take 10, 15 minutes on the couch and be horizontal, because when I get up from that little horizontal break, I usually feel better. That's what my body and my
Mhm.
nervous system needed in that moment. So from a POTS perspective, those were some things I did almost immediately that made a significant difference for me. And then with the EDS piece, it was, and it still continues to be, a journey with managing chronic pain and finding modalities that work for me in
Mhm.
physical therapy, finding the right like manual therapy tools that help with sticky fascia and fascias that's too tight and restricted. So those are some of the biggest things that have helped me the most since my diagnosis. And it's still a journey. I'm still
Mhm.
things that have made a big difference, that can make a big difference for those symptoms. And just understanding it's lifelong management and things will change as you get older, as your hormones change and all of it. So
Well, I love that. I feel like that's like a sneak peek of where we're headed, talking about what you do for women. So let's go back then and help us understand we can start with EDS or POTS. We can start with EDS.
yeah.
What is EDS and what does that feel like? What are the symptoms that go along with it? And also, if you can tie in a little bit of that physiology, like what's different about, I use women because that's what we treat
Yeah.
here. What's different about a woman with EDS as opposed to not?
Yeah. So EDS stands for Ehlers-Danlos Syndrome. And there are 13 different types of EDS. The most common type is hypermobile EDS, and it is the only type of the Ehlers-Danlos syndromes that does not currently have a genetic marker that can come up on lab work. So oftentimes it is underdiagnosed or misdiagnosed. There is also another condition called hypermobility spectrum disorder, which is basically like hypermobile EDS's like sister, right? They kind of overlap, and they often are treated the same exact way. There's just a little bit more of strict diagnostic criteria for hypermobile EDS than there is for hypermobility spectrum disorder. So symptoms can look like joint pain, joint laxity, GI issues, so many systemic features as well, like migraines and painful periods and bladder issues. The list honestly can go on and on and on. And the reason for this is when you have EDS, you have altered connective tissue. And so the collagen that your body makes, which gives your connective tissue the support systemically throughout your body, is altered in EDS, meaning doesn't show up the same way that everyone else's does. It's a little bit more lax, stretchy, and it just has these differences that then cause more things like myofascial restrictions and tension, honestly, in the muscles and fascia and in certain parts of the body that can cause that chronic, deep, aching pain that a lot of people feel with EDS. And because connective tissue comprises your body from head to toe, so it makes up not just your fascia, but also like your blood vessels, your visceral organs, everything in your body, it affects you on a systemic level. So not just showing up in the joints, but showing up in the cardiovascular system, in the digestive system, in the neurological, in your nervous system. So there's a lot of overlapping symptoms here. Some of them are then classified as comorbidities, as with POTS and mast cell activation disorders, pelvic floor disorders, things like that. But for many of us, zebras is what we call us with EDS, the root cause behind all of that is that altered connective tissue.
It's so helpful to think about that because oftentimes we hear about connective tissue, but if you really think mechanically what's going on and you picture a skeleton, right? Like we've seen in biology class hanging on the post. If you have a skeleton and it's all of it, the tissues that were supposed to hold those bones together are now a little more mobile or a little more stretchy, I think two main things happen. I mean, much more than that happens, but two main things happen. One is the body is always a little more unstable, right? Things can stretch further than they need to. So the joints can pop out or you can have these other things that the body is just too mobile. And the second part of that that I think is not talked about enough is that puts the body into fight or flight. The body is constantly trying to brace against that in every way. whether that's bracing with muscles or bracing with that fight or flight, it puts the whole body into this guarded condition, right? And I think that's a lot where that muscle tension comes in is the body says, hey, my head's going to fall this way because my connective tissues that are supposed to be tight enough that the head just sits on the neck or the knee just sits together. Suddenly it's not just sitting together. It has that extra wiggle in it. And so the muscles feel like, ooh, I better clamp down so I keep it all in line. Will you just elaborate on that from your perspective of anything anything else you want to emphasize there?
Joint subluxations and joint dislocations are very common in people with EDS. A dislocation is when the joint has to be manually put back into place versus a subluxation can be, mild to moderate. And you could be walking around with a sublux joint and not even know it, just feel that pain there, but not know that
Yeah.
the subluxation is what's causing it behind it. So yeah, the nervous system is chronically in that fight or flight because your body autonomically is trying so hard to support itself. And that also can lead to that uptick in those autonomic systems that we do see in dysautonomia and POTS because
Mm-hmm.
the nervous system's wired to protect itself, right? To keep holding everything
Yeah.
together and keep yourself upright. And that is part of the reason why a lot of people end up with so much fascial tension as well, because the body's bracing constantly. And it's not like a conscious action that the person's doing. It's just what the body's doing reflexively and typically against gravity. And that's why joint
Right.
positions are the hardest for people.
So explain what you mean by fascial tension. How are you feeling that or seeing that, or how does that show up?
I love talking about fascia because it's a big part of the work I do here, especially with my in-person clients. So fascia is that stretchy connective tissue that surrounds and encapsulates everything in the body, our ligaments, tendons, muscles, organs, and connects head to toe, right? And so what happens is that when we're constantly in that fight or flight mode and constantly guarding, that fascia tends to tighten and thicken more as a bracing mechanism. And there's certain parts of the body where we're having more, like I noticed just patterns with working on people, they have more of these fascial restrictions than others. And when that fascia is tight and restricted, it does lead to like these like thickened adhesions in the body that can cause this tight and burning, deep, aching pain that so many people with EDS feel and
Yeah.
experience. And so part of those fascial restrictions, it affects proprioception. And proprioception is already something that people with EDS struggle with. Proprioception is your body's awareness of where it is and what it's doing in space. So many people with EDS struggle with body mechanics, posture, exercise, and like feeling like they can do the exercises correctly.
What do they say when they're struggling with that? Is that like, I feel clumsy or I fall a lot or like, what are they actually saying?
Yeah, so sometimes, like, you'll see these videos, like, online, people, like, bumping into the table, right, when they feel like they're explaining, their hypermobility. There's a big overlap with neurodivergence and EDS. There's so much research on that, just talking about the overlap between those conditions, and there's proprioceptive differences in people who are neurodivergent as well.
Mm,
But with the fascia restriction specifically, if the fascia is like weighing down on the body and certain muscles, it kind of impedes the body from being able to activate certain muscles correctly, if that makes sense. So
yeah.
from my perspective, just to give you an example, like I work in pelvic health, and one muscle group that a lot of people with pelvic floor disorders have trouble with are their glutes. So almost across the board, there's so many people with EDS who have a really hard time accessing and activating their glute muscles. And it's sometimes it really is like the fascia and the connective tissue is so tight and restricted in and around that trunk and pelvic region that it's inhibiting the body's ability to even access those muscles. So sometimes we have to work on release and then stabilization.
Hmm.
It not just one or the other. It really does require
Yeah.
that like twofold approach.
We're all about choosing products that will work with our bodies without causing harm to our bodies. That is why I want to share with you one of my favorite brands. This is a brand I use regularly and consistently in my own life and in my family, and it is Just Ingredients. From their electrolytes and probiotics to their protein and bone broth powders, every product is made with clean, simple ingredients you can actually pronounce and trust without artificial sweeteners, no fillers, no junk, just real functional nutrition to support your energy, your gut, your hormones, and more. Our team uses these daily and recommends them often in clinic. If you're looking for products that align with your wellness goals, Just Ingredients is a great place to start. One of my favorite things about them is that I don't have to work very hard because they've already done the work. So I don't have to spend time looking at the labels and trying to find the ingredients trying to remember what I was supposed to avoid. They just do that all for me. So I know anything that I buy from them is already screened and is something that I can trust. Use code UPLIFT for her for 10% off at justingredients.us. Now back to the show. So, how does someone know if they have EDS or just hypermobility?
So typically there will be joint joints that move beyond their range of motion, right? So there is a quick screening tool called the Biten scale, which checks 5 joints, but there's 2 on each side. So it's elbows, the knees, the thumb, and then the fifth finger, the index finger, and then the spine. So reaching down towards the floor, being able to touch the floor with your hands. That makes up a 9 point scale. And then for adults, if you're 5 out of 9 or greater, that is considered a positive score. If you're older, then a little bit older, I think it's over 50, then it's a 4 out of 9 is considered a positive score. So that's a quick screening tool that you can do to kind of see if you meet this generalized hypermobility. But there's a lot of faults in the bite-in. It's really not a foolproof scale. It doesn't capture a lot of the joints where most people with EDS have hypermobility, including the ankle, the shoulder, the hips, the jaw. So there's a lot of areas that the bite-in does not even look at. So I have many clients, honestly, who do not score a positive bite-in screening, but they're still, if they find the right specialist, they can still be diagnosed with EDS based on other criteria. But unfortunately, this is like often misunderstood by a lot of physicians as well. And so they'll do the bite and screen. And then if the person doesn't meet criteria based on that, they'll say, oh no, you don't have EDS. See, you're not hypermobile enough. So the diagnostic criteria are being updated next year in 2026 at some point by the Ehlers-Danlos Society, and are working, like, research committees are working on that behind the scenes now. So I'm excited to see what the updated criteria will be, and I'm hoping it will give people more clarity and more direction so that physicians can screen people earlier and give people more of like an idea of what's going on in their bodies sooner, more answers versus question marks or dismissing them if they don't meet those criteria.
Yeah, I think there's so much in this diagnosis and the others that we'll talk about, like POTS. There's so much there that I think can be so validating for patients. I think this subset of patients and subset of women will feel like, what is happening with me? Because I have so many different things going on with me. And oftentimes when they get this unifying diagnosis, it's like, oh, I have one thing happening with me and it's causing this whole list of issues. And I think for some people, that's really actually kind of reassuring. I think the idea that, like, I have this laundry list of diagnoses, which is often what happens, right? You have chronic migraines, you have IBS, you have prolapse, you have painful periods, you have shoulder problems. This person, it's really easy to feel like I am a disaster. Like, what are the chances that I'm this unlucky that I have 18 different diagnoses? But when we can actually unify it and say, no, you've got EDS or you've got HEDS or hypermobility, I think oftentimes that's really settling to people to say, okay, I'm not making it up. I'm not like the unluckiest person in the world. I've got one issue that's manifesting in a lot of different ways.
Absolutely. And that is how I felt after I got my diagnosis. It really, truly, like, for the first time, it all made sense. But
Yeah.
having GI issues, having painful periods, having brain fog, like not being great at cardio, like all these things that I experienced throughout my life that just felt random, like
Yeah.
endometriosis. I was able to finally put them together and have an answer that made sense. And that is why I encourage people, if you can, if you have somebody that you can find for a diagnosis, I find it very validating. There are people out there that don't, they don't think that they need to if they're addressing the symptoms and they're, pretty sure they have it. And if they do have comorbidities and they have good management of those, I totally get, not pursuing that diagnosis. But for me, I find it very helpful because there are some precautions that you may have to take if you do have EDS, if you're going blindly like throughout your life, right, and doing other treatments. So say like high velocity chiropractic adjustments. Like I
Mm.
did that for years with a really bad I have a really bad neck and I did that for a long time, not knowing that that could be causing more harm than good.
Why should a woman care about getting a diagnosis other than the validation of like, okay, at least I understand the physiology of my connective tissues being more lax. But why else would a woman care about getting the diagnosis? How does that affect how they live? And yeah, I'll leave it there. How does that affect how they live?
Yeah, so a couple of things. I think the first thing is not just validate having the validation, but having a new awareness and understanding of your body that you've never had before. Right, like
Yeah.
I was telling you some of the things, like, now I know if I have certain symptoms, I know I need to, like, lay down for 10 minutes and I can get up and I feel better. Like, if you don't
Mm-hmm.
know that you have underlying connective tissue differences that affects your blood vessels, the motility of your blood vessels, then that could really you won't maybe know that there's certain interventions that you can do to treat that. And then you push it down and maybe live with it until
You just feel
right,
bad.
or until one day your nervous system, like, collapses, I can't take this anymore, and you have more bigger issue in the long run. Another thing is, having access to better treatment options, right? So then once you have that understanding and awareness, then you can seek out tools that will actually help you make a difference in your symptoms and manage your condition better long term versus like, you know, throwing spaghetti at a wall and trying to see what sticks at
Mm-hmm.
that point. So there are a lot of resources now. Like there's so many support groups, patient advocate groups. The Ehlers-Danlos Society has a ton of resources online for patients so that like you can understand like this is if you have certain symptoms, oh, that's what that is and that is connected to EDS and this is where I can look and go for treatment. Another reason I would say is the precautions, kind of like what I was telling you before. So, some people with EDS do not respond well to anesthesia, especially local anesthesia. They may not it may not fully work.
Mm.
So, you need to know, I think you need to know that to be able to explain to the provider that's giving you anesthesia, like, hey, I'm going to need more, I'm going to need a different type. We need to work on something here. And the same thing goes for general anesthesia, right? Because sometimes you might have reactions where it may not fully work in that sense too. And you may need to try a
Mm.
type. So those are just some examples.
What about stretching? Because I think a lot of people in this situation feel tight chronically because their muscles are guarding and kind of keeping them upright. And the sort of intuitive um, idea, right? That the thought that a lot of people have is like, oh, I need to do more yoga. I need to do more stretching. Will you talk about that and really what type of movement would be best?
Yes, absolutely. So it is very common in people with EDS to overstretch, to feel
Mm-hmm.
tight, and that they need to stretch, but then they don't feel better after they stretch, right? So
Mm-hmm.
it is not always the best, course of action for people with EDS just to stretch, especially for prolonged periods of time, like holding a stretch for too long, because that can you can come out of that and feel a lot worse. But I find that working on mobility, like more like functional mobility drills and active like range of motion versus sitting in a static stretch can be much more helpful and like getting the body moving, getting blood flowing, helping that fascia kind of work its way out, like some of that restriction and tension in the body versus just holding that static stretch. I think a lot of people don't necessarily know how to breathe. And so if you can find, a stretch or two that are not super deep, into certain parts of the body and just take some nice deep diaphragmatic breaths there and work on calming the nervous system. I think that is something that every hypermobile person should be doing is learning how to breathe correctly from their diaphragm. But yeah, as far as static stretching, I don't recommend a ton of that for my EDS clients. There are some who have a lot of pelvic floor muscle tension. So sometimes there are a few, maybe one or two things that we might hold statically for really no
Hmm.
longer than 1 minute while we practice that breathing, because that can be good for the pelvic floor. But for the most part, yeah, we're not advising on that because it doesn't really do.
It's not the
Yeah.
problem. Yeah. What about strength training? What about
Mhm.
building muscle? Does that go well for people with hypermobility, or should they be doing more of it or cautious about
Mhm.
it?
I think it's really important for
Hmm.
EDS to strength train. It's just a matter of finding what works best for your body and not doing too much too soon or too much at one time. I personally hurt my shoulder really bad, not knowing that I had like a thoracic outlet syndrome and bad neck on this side, doing a lot of upper body strengthening in like a boot camp style class. This was before diagnosis. So although I thought I was doing something really good for my body, I ended up injuring myself. So I think taking things slower, being way over methodical about how we're
Yeah.
doing the exercises is really important. My one physical therapist used to tell me that I just need to lift like I'm a bodybuilder, like really slow and controlled and working on just isolating certain muscle groups, especially when I'm doing my upper body at a time, and listening to my body as I do it versus like forcing myself to do anything that doesn't feel right.
But man, form matters so much, right?
Or,
I mean, in this case,
mhm.
especially.
Exactly. And then going back to like the fascia part too, if you're finding that you're trying to work on something and it just feels like super tight and just doesn't feel right when you are doing that strength training, it could be that the fascia in that part of the body is like really tight. And sometimes doing
Hmm.
a little bit of release work, if that feels good for the person, everybody with EDS is different. So a lot of people do well with fascia release. But there are, I'm not going to say there are some people that may not. So you just have to find what
Yeah.
works best for you. But sometimes that can be really helpful to do prior to the strength training part. And then you have like better activation of the muscles.
Okay, so tell us then, where where does someone go to be diagnosed?
And this is a great question. So right now, when I answer this question, I usually refer people to the Ehlers-Danlos Society's provider directory because there are physicians that are on there who are knowledgeable in diagnosing and treating EDS and associated comorbidities. If you are somewhere where there is no provider listed, then you can print the diagnostic criteria from the EDS Society website and you can take it to your primary care provider and say, hey, I've gone through this criteria. I think I might have this condition and explains a lot of my symptoms. Would you be willing to go through this with me and give me your opinion? And if they're not, well, then maybe ask, can you refer me to somebody who might be able to help me with this? And
Hmm.
truly advocate for yourself in that way. One step and one part of the diagnostic criteria is to rule, especially for hypermobile EDS, is what I'm referring to here, is to rule out other connective tissue disorders or other types of EDS. So, doing a genetic test, which can be done like there's various like third party companies, right? You can do the saliva test and then you can send that out, get your results back, and you can rule it out that way. So, it doesn't have to be this super complicated thing, but I feel like a lot of medical providers are like scared to go there or you just aren't familiar enough with it.
Yeah.
And I'm hoping that as time goes on and more people are speaking out about it and understanding it more, that will not be the case forever. Yeah.
Yeah. Yeah. Now, what about finding practitioners other than the practitioners that diagnose? So, bodywork
Mhm.
practitioners, physical therapists, occupational therapists. Do they have a directory for that as well, or is that more of a Google search?
Yes, we are all on the same provider directory. So it will
Okay.
be doctors, yeah, physical therapists, occupational therapists, massage therapists, mental health therapist.
Hmm.
So there are various types of providers that are on that directory.
And you mentioned a lot of this before, but will you reiterate, like, what are some of the things that maybe we haven't emphasized in terms of symptoms or things that, if a woman is listening and she's like, I wonder if this could be me. Will you just rattle off a list of the things that go along with this diagnosis that would really help someone listening say, oh gosh, I have every one of those things that she just listed?
Yes. Okay. So let me go from like a head to toe kind of perspective and
Yeah.
kind of go from there. So from thinking up at the head, like brain fog, any sort of neurodivergence, so ADHD or autism, right? If you have any of those comorbidities, any sort of dental crowding, a high palate, that can be often seen in people with EDS, neck or shoulder pain or problems, any sort of disc herniations, chronic neck pain, TMJ pain, so hypermobile jaw, and noticing that clicking and popping all the time. You might have some sinus issues. A lot of people with EDS have throat issues. They'll have like a chronic sore throat or chronic like redness in their throat, just feeling like irritation. You might lose your voice easily. You might have trouble swallowing. And then going down more, like thoracic outlet syndrome is very common. That will overlap with sometimes neck and just general shoulder pain, dislocations of any kind. So if you're, say, a high school athlete, middle school athlete, and you're like dislocating your shoulder all the time, dislocating your knee, your hip, those are all big red flags. And then acid reflux is another common thing you might see. Feeling generally bloated, um, unwell after eating. IBS is a huge red flag. Functional GI disorders are very, very common in people with EDS. So having chronic constipation and or diarrhea, like on a regular basis, having multiple food intolerances, and then thinking about the skin, so allergies, hives, rashes, eczema, all of that can be involved. I know the list goes on and on. And
Mm-hmm.
going down into the pelvis, so we might think about things like endometriosis, chronic pelvic pain, bladder urgency and frequency, painful periods, pain with intercourse. All of those things can be involved. You might see like a dryness of the skin, dryness of the eyes, dryness of the mouth. And with POTS specifically, things like, because I'm just thinking about the overlap with EDS, dizziness, lightheadedness, high resting heart rate that increases upon standing, and orthostatic intolerance, meaning it's hard to stand for extended periods of time. And then joint pain, muscle aches, and feeling like poor proprioception, like body awareness, feeling clumsy, kind of like you're injury prone. What else? I think that covers a lot of things.
Yeah.
Yeah.
Yeah. One question was with patients who have that much going on, it seems like there's also a higher sensitivity. And of course, some of that can go with the neurodivergence, but sensitivity to sounds or sensitivity to touch, is that something that, like, they call them highly sensitive people, right? HSPs, of having that higher sensitivity. Does that go along with that as well?
Yeah, absolutely.
Yeah.
And I would say, it's somewhere at the intersection of, connective tissue differences and neurodivergence. Not sure which one,
Yeah.
takes the cap for that. But yeah, I would say it's very common.
Have you ever tried red light therapy? At Uplift for Her, we are big fans, and we and I use it ourselves regularly. Red light therapy helps support energy, healing, reduce inflammation, and improve skin health. And there's more and more data to support that. One of my favorite at home options is the Loom Box, a powerful clinical grade device that combines red light with near infrared light, so you're getting both surface level and deeper tissue support. It's easy to use and makes consistent red light therapy actually doable. One of the things that I love about the Loom Box is how easy it is and how compact it is. So you can grab it out really quickly, use it while you're in bed, getting ready to go to sleep, and then put it away and not have to unpack a big, complicated device. I use it most nights as I'm going to bed, mostly just for relaxation. I find I feel very calm and wake up with good energy. So it is one of my favorite wellness add ons. If you're thinking about adding it to your wellness routine, we have a link in the show notes that will save you $250 off of a Loom Box. You can also find it on our favorite products page at upliftforher.com. Now back to the show. Well, walk us through, because your specialty in hypermobility is actually pelvic floor,
Mhm.
in addition to everything else. Walk us through, what does that look like when a patient comes in, either knew that she had hypermobility or you're finding that that's part of the situation and they're having pelvic floor issues. What does that look like? How do you help someone really feel better once they're in a situation where they're struggling?
Yeah. So I was working in a general pelvic floor therapy practice and just noticed that I kept seeing patterns. And this was after I got my diagnosis. And there's just certain clients that just don't always fit the normal mold of like improvement. And I can tell there's a higher level of care that's needed and collaborative care, honestly, for management of the conditions. And sometimes that might be like a functional medicine or a hormone specialist or, gastrointestinal doctor. So I definitely have worked on getting provider directory of referrals that I can send people to because often that's what we're managing is a lot of comorbidities. But now that I've opened my practice and I have been marketing to clients with hypermobility for well over a year, I'm getting mostly that clientele walking in the door.
Hmm.
Some people are diagnosed, some people are, on the fence, like I think I have this, but I'm not sure. So I just kind of keep my approach generally the same for those clients. But if they are somebody who's not diagnosed, I will then refer them to somebody that they can be, if they want to pursue that, they have
Yeah.
the ability to do that. But we will look at lifestyle factors like crazy. I'm an occupational therapist, so I value my education in being able to meet clients where they're at and work on changing little things, in the routine and habits and tracking patterns and seeing what we can do to help improve things from a wellness and lifestyle perspective. So we dive deep into that on the initial evaluation. And honestly, at the first visit, I don't rush anyone. I let everyone tell their entire story. I don't, make anyone feel like they have to hurry up, let's wrap it up because so many of these women who come in here have done that many times and they've told
Yeah.
this story over and over again. And honestly, just having someone to listen is so important. So we do that. And then we work on like looking at their posture, looking at their breathing, their body mechanics, how they do certain movements, and noticing little patterns in the body and things I can pick up on. We'll take notes of that, and then we'll do like a hands-on assessment. So we'll look at the external structures, like the rib cage, the diaphragm, the abdominal wall, the inner thigh muscles, the glute muscles, the hips, your spine. Look at spinal mobility. And then if the person is okay with it and they consent, we will do maybe an internal pelvic floor muscle assessment to check the tone and the coordination of the pelvic floor muscles. And that part is always optional, but it does provide a lot of information for us as pelvic rehab providers to be able to put the full, picture together with
Yeah.
the treatment plan for the client. And then from there, we're working on like lifestyle factors. I really try to think of exercise and movement as a way to blend it into everyday activities versus, I don't know, a lot of clients are neurodivergent. You give them a list of exercises, it's like, I don't know when I'm
Yeah.
going to do all these. So I try to find ways to teach them how to do it within their day to day activities.
I think that's so great. I think these women who struggle with hypermobility and this list of issues that can come up, I think so many of them end up being kind of labeled as problem patients or, hypochondriacs or, they'll get the typical, I go to my doctor and my doctor says, I'm sorry, you can only bring up one concern today. And this poor patient is like, I've got like 8 things that are bothering me and I don't know where else to go. Like, I don't know who to talk to about it. And so to have a practitioner that can say like, yeah, this makes sense. Tell me more, tell me more, tell me more. I think is really quite healing in and of itself. Will you talk a little bit more about the nervous system? Because I think what we just mentioned with feeling, dismissed or gaslit or unheard, that alone can trigger the nervous system, but the body alone as well can trigger the nervous system to be in this state of fight or flight as the body just feels somewhat unstable. Will you talk about how you approach nervous system regulation and helping them manage that? I don't want to say manage their stress because that's so not adequate here, but how do you help them learn how to support that nervous system piece?
Yes. So I think right from the start, one of the biggest pieces is just really understanding your body and knowing what it's telling you. Because I think so many of us are walking around dissociated and disconnected and just like so
Yeah.
used to pushing symptoms down that we don't realize anything's wrong until it's like too late and then everything's wrong, everything's flaring.
Yeah.
So trying to like pick up on the little triggers and the little signs that your body's showing you And knowing then, okay, if I experience this, what are some things I can put inside my toolbox, my personal toolbox, to help me manage that symptom? So, from a nervous system perspective, I like to think of it as like we have to have the foundation before we're like biohacking our nervous system, right? So many people with chronic illness are not sleeping. So, if you are not
Hmm.
sleeping, you are going to feel terrible. Your autonomic nervous system is going to be out of whack. So, we need to talk about ways to improve sleep. We need to talk about ways to improve, like from a POTS perspective, making sure we're consuming enough fluids, making sure we're eating adequate calories throughout the day and not just eating one huge meal, once a day, or eating, I hate to say, like, like things that are just ultra processed and sugar
Yeah.
and all the things. So working on that piece. And then from a sensory perspective, finding ways that you can like listen to your body. If you notice that when you wear a certain type of clothing, it makes you feel not great, or you feel more
Hmm.
anxious, like just eliminate that. You don't
Yeah.
need to wear that. I mean, even from a pelvic perspective too, certain types of clothes can cause more pelvic floor symptoms, like high waisted or too tight of waisted pants can make you feel like it can prolapse symptoms can be a lot more noticeable. So finding ways to manage things just from a simple lifestyle adjustment can make a big difference for people. And sometimes I have to say, like, hey, did you ever just think about trying this, for example? And they will say, like, I had never even thought that of something so simple. And sometimes that is what it is. It is a simple fix, but it's helping people kind of break down the pieces of their day to day life and find strategies that don't seem so hard, that don't seem so complicated, because we sometimes overcomplicate things. And if you look online, you can see like heal your nervous system in 30 days and do this the next time.
Right. Right.
Maybe some of those things are great, but for some people, like that's overwhelming, right? And
Hmm.
it's hard to stick with all of these special plans and things that you have to do. But if you can find like 2 to 3 things that work for you that you can do consistently that don't feel super overwhelming, like that's how you can make the big difference. Because you show
Hmm.
up for yourself every day within your habits, your routines, the roles that you have in your life. That's how you make long term change versus just doing, sauna and cold plunge once a week.
Right.
So,
I think it comes back full circle to just hearing your own healing story of these. I mean, yes, you had some medication help and yes, you learned some things about your body and that's been a journey for you, but so much of the value came by really, you've said it a couple times, tuning into your body and really just asking yourself, like, body, what do you need? Where are you at right now? And not pushing through things, but also just having that underlying understanding of the physiology a little bit of saying, okay, my body is going to need these things that are different than what my friend may need or my sister may need. Like, I just have to know what my body's needs are. And I think that's something that's really true for all of us, but especially true when the body may not be functioning exactly the way that it's supposed to,
yeah.
right? So I appreciate you saying, sometimes we just have to say, don't push through. Just take that horizontal time. Just get that water in. Just take that nervous system break.
Yeah.
In just the last couple minutes, this is not enough time, but tell us about POTS and what it is and how that comes into this.
Yes. So, like I said, this was a big one for me because it was a big game changer in getting like understanding my body more. But POTS is a nervous system condition. It's dysfunction of the autonomic nervous system, and it's a type of dysautonomia. And it's characterized by an increase in heart rate by over 30 beats per minute when you go from laying down to standing up. So if you are somebody who has access to be able to check with an Apple Watch, be able to check your heart rate, and you might, connect with some of the other symptoms like dizziness or brain fog or nausea or feeling like just generally a sense of like feeling out of it, then it might be helpful to look at that. Like lay down for 5 minutes, see what your resting heart rate is, and then stand up and see what it is after you stand up. So the thing about POTS that's interesting is it's often treated or referred to be evaluated by cardiologists, but well, I have found just from my experience working with so many people, is that they're not always the expert in the condition because it really is a nervous system thing. And the autonomic nervous system controls, the heart rate, right? It controls our respiration rate. And it can often feel like anxiety. So sometimes people are dismissed with, oh, it's just anxiety. And sometimes you can wear things, throughout your, like the heart monitors and the different tests that you can do. And even then, like they're not capturing the full picture of what a person's going through. And then when it comes to like the actual diagnostic test, like a tilt table test, some people might get like a heart rate increase by like 28, 29 beats a minute,
Yeah.
and they'll
Yeah.
be told that they don't meet diagnostic criteria for POTS. So that part can be a little frustrating because, like I said, it is a type of dysautonomia, and dysautonomia is one of the key features of that is orthostatic intolerance, having that trouble being upright, standing still, upright against gravity. And so even if you don't meet full criteria for POTS, you can often still have dysautonomia.
Will you explain what dysautonomia is?
Yeah, so that there are different types of dysautonomia. So there's orthostatic hypotension, there's POTS, there's vasovagal syncope, and various others. That's dysfunction of the autonomic nervous system. And sometimes there's an underlying root cause, like many people after, like in the post COVID world with long COVID, they ended up with POTS and symptoms of dysautonomia. Ehlers-Danlos Syndrome is an underlying cause because when you have that laxity in your connective tissue, that affects your venous return and that can cause that spike in heart rate. And because you don't have the return blood flow to the brain as you normally would expect in with normal connective tissue. So that's dysautonomia is a sometimes a better term because not everyone will be diagnosed with POTS or meet that diagnostic criteria, but a lot of people can relate to the general umbrella of symptoms of dysautonomia.
Yeah, so the autonomic nervous system is supposed to keep us safe. It's supposed to help us fight tigers, right? So we see a tiger, the autonomic nervous system says, "Oh, I should speed up my heart rate. I should raise my blood pressure. I should raise my respiratory rate so that I can sprint from this tiger." But because of various circumstances, when dysautonomia happens, and that's when that connection gets messed up. So we might say, like, I'm going to get up and go. And we don't, the body doesn't support that. It doesn't speed up our heart rate, or it doesn't raise our blood pressure the way that it's supposed to. So you may stand up real quick and need a little boost in blood pressure appropriately, and it just bottoms out. So you'll get dizzy or lightheaded. And then the opposite can happen too, where you stand up and you get going and it overreacts. So you have an overreactive autonomic response that's that overreactive fight or flight. And some people get sort of a split response where some of their body is acting like they're in fight or flight, and some of it's like they could use a little more fight or flight. And so the body just feels very disconnected
Absolutely.
to its surroundings.
Absolutely. And then dysautonomia can also affect things like the GI system, just because that our gastrointestinal
It's all connected.
exactly is controlled by the autonomic
Yeah.
nervous system as well.
So what do we do about POTS? What are you doing to help people? You mentioned electrolytes. Tell us a little bit more about how people and let me back up a second. I will say kind of the nice thing is that treating POTS has some really safe things to try. And so even if you aren't getting that diagnosis, a lot of these things you can try anyway and just see if you feel better. And if you feel better, then by all means do them. So walk us through some of those helpful tips.
Absolutely. So yeah, electrolytes is one great thing. And most people when they come, they already know that part. You need to hydrate, you need to drink
Yeah.
electrolytes. Compression therapy is another thing that can be helpful for people. And that's not just like compression socks, that's like a thigh high compression or abdominal compression, like up to the rib cage. There's a lot of people that don't love the feeling of compression. Like I fall into that category. I don't really like tight fitting clothes. It makes me feel like more fight or flighty, like I can't breathe.
Yeah.
And it's just honestly, it's achy. So that might work for some, may not work for others. Other things we can do is elevate the head of the bed when sleeping. So either sleep on a wedge pillow or honestly, like actively elevate the head of the bed, like with blocks underneath the bed. That can just help with the transition of waking up in the morning. Most people with POTS feel not great in the morning. That's when symptoms are usually the highest. So being able to transition from laying down all night to then getting up and starting your day, sometimes that can make that part a little bit easier. Other things we can do are working on graded exercises. And so this can be scary sometimes for people, especially if that exercise has been known to flare them in the past. So it really is like meeting the person where they're at and finding strategies that work for them in that stage of their life. Usually starting with supine movement, working to seat it, and then eventually to graded progression to standing. So it's very much tailored to the individual. And there are protocols out there. There is the CHOP protocol, the Levine protocol, but you don't want to necessarily just go. You don't. It may not work for everybody, like certain protocols. So we just try to follow uh, what that person needs as an individual versus making sure they're meeting some sort of standard that may not always work. And then other things, like kind of like I talked about before, finding out if there are certain triggers that happen for you. Like certain people don't tolerate caffeine very well. Some certain people, alcohol is a big trigger for a lot of people. Certain types of foods might upset your GI system and can wreak some havoc and cause more POT symptoms. And if you eat too much at one time, that can be an issue. So for a lot of people, if they eat like a big meal, then all the blood will go to work on digesting food, and then you won't have as much blood flow to the brain. And then there is an overlap, and this could honestly be like a whole other episode, but getting into pelvic venous disorders like May-Thurner syndrome and Nutcracker syndrome, that when there is trouble with getting like that blood flow out of the pelvis, that
Yeah.
that can cause a lot of POT symptoms. And there's a lot of overlap there for sure. And then mast cell activation disorders, we didn't even get into that too much, but there's a big overlap between mast cell triggers and POTS. So sometimes working on, if you can find somebody to help you with mast cell stabilization, that can also help with POTS and dysautonomia symptoms. So it's not one or two things, unfortunately, that like make all the difference. But I find I was kind of say, like, if you think of like a pie chart, it's a little bit that makes up your full, recovery piece or like
Yeah.
management piece, and just finding what works best for you. And it will definitely be different from person A to person B to person C. So.
Well, that's super helpful. What else are we missing? What do you really want to make sure that the messages that you're sending to women who are in this camp of this complex sort of family of diagnoses?
Yeah. So I would say the biggest thing is there is hope. Like I am one of you. Like I totally understand and get what it's like to grow up in a body that feels chaotic and feels just unruly and not well all the time and feels misunderstood. And it may not be a straightforward path to feeling your best, but I believe the more you understand your body, and this is why I raise so much awareness about these things, the better chance you have to feel better and to find your toolkit that works for you in managing your symptoms. You can go from being symptomatic every single day of your life to maybe having days here and there where symptoms will flare. And to me, that is huge. I will never say to anyone that you're going to feel 100% better because you did X, Y, and Z. There might be people out there who can, right? Who can feel like they've recovered from these conditions, or EDS they're not really recovering from, but can feel like they feel maybe more like their old self. But it is more of something that you're going to have to manage long term. But there are options, and those treatment options come from that place of understanding. And if you're at a place where you just feel like, oh, I relate to so much of this, but I've never been able to put a name to it, like look into it. Go to the EDS Society website. Social media does have a lot of resources out there too, but just finding some support in understanding your body and what's going on can make such a huge difference when it comes to a connective tissue disorder like EDS, because it really does impact so many different systems that seem unrelated, but they are related as we've gotten to in this conversation. So.
Well, thank you so much for sharing that. I love that you're giving women hope, and I love that you can give hope from a practitioner space of I've seen people get better, and also from your own experience of I've figured out how to live in a way that feels a little more stable and feels a little more strength, that you can accomplish that. Where can women find you, Nicole? How can they work with you?
Oh, yes. So my practice website is intuitivetherapiespelvichealth.com. And then you can find me on Instagram and TikTok at Nicole Pelvic OT. And yeah, I'm sharing, different things on there for education and awareness, and just trying to educate people who may not have known that X was connected to Y, and just help people learn more about their bodies. So I hope that if you do check my content out, you'll be able to resonate with some of that.
Yeah. Well, thank you for your time and sharing your expertise. And I think this has been a really important conversation. So thanks for being here.
Yes, thank you so much for having me. I really appreciate it.
Thank you so much for tuning in to today's episode. A huge thank you to our guests for sharing their insights and time with us. We are grateful for the incredible support from our sponsors and to all of you listening. We couldn't do this without you. If you enjoyed this episode, please consider subscribing on your favorite platform. You can find us on our website, upliftforher.com, YouTube, Apple Podcasts, Spotify, or wherever you love to listen. And if you found value here today, please share this episode with someone who would benefit from it. Leave us a comment or give us a review. It really helps us reach more listeners like you. Thank you for being part of our community. Stay tuned for our next episode. Lastly, this information is for educational purposes only and not intended to be medical advice.